So I want to share a story about how my team and I were able to take a horrible dental experience and turn it into a 5-star review. One of the most difficult things to do in dentistry is when we're working on patients and we don't really know what the restorative outcome of the tooth will be. This can happen if you have a tooth with a crack in it where you don't know how deep the crack propagates, or this can happen when you have a radio-opaque material like a crown where you can't really see how deep the decay extends under a crown. And there's a variety of other ways where you may not know exactly what's going to happen when you start working with your patient on a tooth that may be unpredictable. And of course, as dentists, it's our responsibility to manage the expectations of our patients by letting them know all the possible restorative outcomes. But sometimes we're still left in these very uncomfortable situations where we have to talk to our patients about different outcomes, or that maybe this tooth can no longer be crowned or it's unrestorable, and we have to break the news to them, and that can be very difficult to do. I just had this situation happen recently, and let me tell you how I handled it, and hopefully you guys gain something out of it as well. So I have a really sweet patient that called the office and let us know that her crown was moving, that it was mobile. And we brought her in for the exam, and I did the exam, and obviously there was decay underneath the crown. I let her know that we're gonna have to schedule her to take the crown off, see what's going on under the crown, and hopefully we're able to do another crown for her that lasts the rest of her life. Either way, she came in, we got her numbed up, she did really well with the anesthesia, and we were ready to begin the procedure. So I get started, I section the crown off, and the way I section the crown, for anyone that is wondering, is I take a porcelain cutting burr to remove the porcelain off in a reverse L-shaped pattern, and then I take a carbide burr if it's a porcelain fused to metal crown, and I take that carbide burr to remove the metal, and then I take a curved T-bar and I twist, trying to leverage the crown off in one piece. If it doesn't come off in one piece, or if it's a really well bonded crown, then you just have to remove the crown off with a large diamond burr. So either way, it was no more than 5 minutes when I created the section I needed, and I took my curved T-bar and I twist the crown off, and lo and behold, when I take the crown off, there is almost nothing remaining under the crown, meaning that the tooth was completely decayed, completely rotted out. I mean, totally flat along the gum line, no way to restore the tooth, and that the tooth needs to be extracted. And when that happened, my heart sunk. I literally hate those feelings where I have to break news to a patient that is not so favorable. I would much rather be the person that says, we can save the tooth, everything's fine, and oh man, the procedure went great. But sometimes, because of the unpredictability of some procedures, we have to break this news to our patients. And I was just worrying about how I'm going to let her know and what she's gonna think, or how she's just gonna perceive this whole experience. I just let her know that, it doesn't look like there's a lot of tooth structure left, and I wanna be able to put a crown on that lasts a long time, and I just don't see a way to do that, and we have to explore maybe other possibilities. Maybe we have to consider implant, but let me take a picture, let me show you so that we can talk. And she's obviously fearful and she's scared because she's never had a tooth extracted before. And at this point, I think a lot of dentists don't know what to do. I have learned that the best thing to do is to shut up and listen. Sit down with the patient. Listen to what they have to say. You don't have to jump into, oh, we have to do an implant, we have to do this, we have to do that. Just tell them what you saw. You're the doctor. Tell them objectively what you saw. Listen to their concerns and respond to their questions in the best way you can. And this is the problem that I had originally when I first started, where I was kind of rushing in to solutions. So I told her, it's like, I see that you're upset and I want to be there for you, and I'm going to do everything in my power to make sure that you're happy, to make sure that everything is right. What is your concern? She told me, oh, I don't want to be without a missing tooth. She was scared about having an extraction done. She's never had an extraction done before. I let her know that if you want, I can do the extraction here right now, or because it's a root canal treated tooth, I can send you to an oral surgeon and they can take the extraction out and do the implant at the same time. And that might be a better option for you because you don't want to have multiple appointments and you're already very anxious. And I just let her know that I'm there for her. I gave her my personal cell phone number. I let her know that I want her to think about all the options, and I'm going to be there no matter what to guide her to the next step of treatment. And she understood and she thanked me and she went on her way. And, honestly, I felt really bad. After that appointment, I was like, oh man, we were here, we were going to do a crown, and it turned into something else. And obviously, she was emotional. I could see tears coming in her eyes, and that just makes me feel horrible. I don't like that feeling. It's a horrible feeling. And when she left, I felt down, I went to lunch, and then something amazing happened. I checked my phone, and there was a 5-star review for our office in which she basically said that she's happy that she has a dentist that cares for her and that the team was so welcoming and kind. And if you're lucky enough to have a team like that, you're going to be better prepared to see patients, make them feel comfortable, and make them want to come back to your practice. If you guys have any stories of your own, please leave it down in the comment section below. It really helps us as a community of dentists if we share our stories, share our experiences, and I think that we can become better because of it.